One of JJ's really shining qualities was his kindness. He was also really curious, really fun.
We spent time with him in all kinds of circumstances, and he was just a really easygoing child, very easy to parent.
JJ was also a child who could transform somebody who had never been sure if they wanted children, was still ambiguous about kids, I'd say even up to the day in which I had him, and transformed me into somebody who loved being a parent.
He had a great day, and then in the mid-afternoon he started to not seem great, and we took his temperature and it was 101.3 maybe.
He clearly was coming down with something, but it wasn't qualitatively different from any of the other garden variety illnesses that little kids who are in daycare full-time like he was get.
And we gave him Tylenol, he responded to that, and early bedtime and dinner and bath, and then he was cold at midnight.
Most people don't know, we certainly didn't know. Flu can kill quickly and without warning. We were aware that influenza was a scary disease and that it could make people very sick and kill them, but that we would have time to act. We had no opportunity to help him besides do all that we could from the start, which is vaccinate him.
My name is Melanie Wellington. I am a pediatric infectious diseases specialist, which means I take care of children with complex infections. And another one of my jobs is to serve as a resource for the pediatricians of our area when they have questions about infections, immunizations, other prevention strategies. It's really important for kids to receive the flu vaccine for two main reasons. The first is it will protect them. The second reason is that children, especially 5 to 17-year-olds, are really the main passers of flu in our world. Anybody who's ever spent time with a kid who's a toddler knows that that's what they do, right? They go around sharing things, and unfortunately they share infections just as much as they share their toys. The most common thing I hear when people ask me about flu vaccine is, why would I bother to get it at all? Flu's not that big of a deal. Everybody gets flu all the time. It is true that there's a lot of flu in the world, and a lot of people get flu every year. Even if you have just the mild version of flu, you get pretty sick. You have a fever, you feel rotten, you have terrible muscle aches or headaches, and you feel that way for a week or maybe even 2 weeks. But sometimes it's a much bigger deal. And we really need to make sure that we're protecting you, your child, and all the other people in our community from flu. And the best way to do it is by using the flu vaccine, which is safe and effective at keeping people healthy. Even if you just get the most mild version of flu, it's still something worth preventing. It's never fun to have a side effect. But sometimes when you get a flu vaccine, you'll have a little bit of a fever. You'll have some muscle aches where the vaccine was. You might feel kind of crummy for a day or two. Those are actually signs that your body's immune response is learning from the vaccine how to protect you from flu.
JJ was vaccinated, everything available, including influenza. No vaccine is perfect in terms of providing perfect protection against a disease. We did everything that we could have possibly done to keep him healthy and safe. The problem is that influenza vaccination rates in our communities are well below what we need them to be in order to protect people the most effectively, and especially the vulnerable, like the young and the elderly.
There are people that can't get vaccinated. There are people that the vaccines are less effective on. There are people that are especially sensitive to one disease or another that are relying on the community to not transmit that disease to them.
If somebody has an infection, but all of the people around them are not vulnerable, they've been immunized and they're protected and they're less likely to be infected, then that spread of the virus through the community is really halted. And so when we vaccinate ourselves and our children, we can protect our kids' grandparents, we can protect our neighbors, we can protect the kid who sits next to our kid in class. In 2019-2020, which is the last flu season that we had before COVID, the CDC, Centers for Disease Control, estimates that flu vaccine alone in the US prevented 7 million infections with flu, 3 million doctor visits, 100,000 hospitalizations, and 7,000 deaths. Just in the US, flu vaccine itself. getting the flu vaccine doesn't mean you'll never get flu. It would be great if it did. Some children will still get flu, but when they do, if they've been vaccinated, they're usually protected from the more severe disease. So for every 100 children who would have had to go to the doctor's office because their flu was bad and they needed help, if they're vaccinated, 50 to 60 of those kids will never have to go to the doctor at all. For every 100 children who in the past would have had to be in an intensive care unit because their flu was so bad, if we vaccinate all those kids, again, 50 to 60 of those kids won't have to be in the intensive care unit. And for the kids who are immunized from flu, for every 4 kids who would have died, 3 of them won't die. And so it's still a tragedy, no matter how we look at it, but we have the ability to make so many fewer families have to face this issue.
I do not 100% believe that everything happens for a reason. JJ's death didn't happen because it was supposed to. It wasn't preordained. It wasn't a good thing. It was the worst thing that had ever happened to us. But I think that we were able to take that situation and make as much good out of it as we could. And I think that's really helped us get to a much better place today.
Service is the antidote to depression. I know that throughout the pandemic, people were uplifted by how we tried to be positive and make meaning out of his death, to view our experience with JJ as 3 years of something that was given, of something for us to enjoy and celebrate. So I tried to focus on his life.
It's important to try to connect with people who have these fears with where they're at and ask them in a way that is genuinely curious and, attempt to be as non-judgmental as you can. Like, what scares you? Why are you nervous about vaccines? What could I tell you, or what could the scientific world show you that would make you less frightened?
I hear a lot about people asking about flu vaccine is, well, I'm pregnant, or I have this medical problem, or I have that medical problem, so I shouldn't get flu vaccine. Actually, people who are pregnant and have a variety of medical conditions are the people who are at highest risk of complications from flu infection. And so those are the people we can protect the best with flu vaccine. It is absolutely recommended to get flu vaccine if you're pregnant. And as far as other medical conditions, if you're not sure, talk with your doctor, because flu vaccine will probably be an important part of protecting yourself. It is a pain in the neck to get the whole family on to get flu vaccine. And the more kids you've got in your family, the more of a pain in the neck it is. But remember, when we get infected with something, we don't do it when it's convenient. It always seems to be the worst week of the year when my family gets sick. And it doesn't happen all at once either. One kid will bring it home from school, and that kid is sick and miserable for a couple days. And right as they're starting to get better, the next kid gets sick and miserable. And this goes on for a little while, and then you know who gets it last? Me. So right as all my sick and miserable kids are bored because they've been home and they're miserable because they've been sick, I start to feel bad. So it really ends up being multiple weeks, if not even a month, of inconvenience compared to an hour or 2 of inconvenience to go out and get that vaccine. The great news now is places like Walgreens, CVS, Hy-Vee, your neighborhood pharmacy, they're all carrying flu vaccine, and the pharmacist there can vaccinate. So the next time you're going out to get groceries, just take the kids along and go ahead and get your flu vaccine. Or the next time you're gonna go out with the family for dinner, stop at Hy-Vee on the way out and get vaccinated.
Just by getting a vaccine, you're changing outcomes for yourself and also that ripple through the community. We could eradicate flu. Muhammad Ali's quote that I love is, "Impossible is an opinion. Impossible is temporary."